Clinical methods. Objectives of this lecture. At the end of this lecture, you can define what we mean by clinical methods, steps in making diagnosis, understand the steps of history taking, understand how to analyze pain, able to list the important symptoms of the different systems, able to understand the steps of general physical examination. So by definition, clinical methods is the term used to describe a properly organized approach to the patient's and to his or her disease. Diagnosis should precede treatment whenever possible, but the main aim of the doctor is to help the patient and family manage the problems caused by a disease where possible, offer treatment, cure, or prevention. Regarding diagnosis, there are two main steps in making a diagnosis. First is to establish the clinical features by history taking, physical examination, and investigation. And this format is called database. The second is the interpretation of these data, if possible, in terms of disordered function and structure. That is pathology. Pathology can mean disease or social pathology. Now, to proceed to communication, we have what is called the art of history taking, and this represents the relation between the patient and doctor. And this is definitely an art in order to get the data and the information from the patient in order to help for making their diagnosis and treatment. Headings to be used in history taking. Preliminary data, that is the name, age, sex, occupation, address, religion, marital status, date of admission, and date of examination. Presenting, that is chief complaint and its duration. History of present illness, menstrual history, medication, drugs, blood transfusion, and vaccination, history of previous illness, socio-economics history, family history, personal history. So all these should be covered during history taking. Now we start with presenting, that is chief complaint. Simply, it means the problem which made the patient seek medical help. Some patients have more than one main complaint, and a few, particularly the neurotic, have so many that is impossible to identify a single chief complaint. For these patients, the presenting complaints themselves represent the problem rather than the underlying disease. The duration of symptomatic events is especially important since the chronology of the illness will provide valuable clues to the pathological process underlying it. The question of duration may be difficult, as many people, especially elderly, often find difficult to remember the duration of their illness. Most patients with long-standing symptoms tend to date them by events or seasons rather than by years, even though there is no causal relationship. History of present illness. You have to ask the patient to tell you the story of the illness from the beginning. Ideally, you should allow this to continue without interruption, except in certain circumstances when the patient is talkative, when the patient go away from the main problem. So you kindly and softly return them back to the same point that you want them to concentrate on. Always begin by talking with the patient, excluding others. However, you may find it helpful to seek clarification or even an alternative or objective view of the history from the relative or friends. When the patient has given you an initial description of her symptoms, suggest that you would like to find out more about these symptoms. Some patients have symptoms which come and go, and it is then important to try to find out whether the relapses and remissions are related in any way to times, seasons, or events in the patient's life. Present history should contain the following: onset of the illness, which may not be the same as chief complaint onset, especially in those with chronic illnesses like ischemic heart disease and diabetes. Course of the illness, reason for presentation, then analysis of chief complaint, and lastly, review of other systems. Analysis of pain as a symptom. When did it start? What was the first thing noticed? Progress since then? Ever had it before? This word, Socrates, summarizes the important point that required in the analysis of pain, and each letter in this word stands for the character of pain analysis. So S means the site, O, onset, whether it is gradual or sudden, C, the character of the pain, R, radiation, that there's radiation, A, associations, that is, for example, nausea, sweating, T, for timing of pain, duration, exacerbation and alleviating factors, severity, example, and the scale of 1 to 10 compared with worst ever previous pain. So by severity, you mean that the patient point whether the pain is from 1 to 10. What is the degree of their pain? As 1 stands for mild disease and 10 for severe disease, or to compare their disease with the previous ever worst pain. So in more detail about these characteristics of pain, by sight, sometimes we have somatic pain that is often well localized. Example, when you have sprained ankle. Visceral pain, more diffuse. Example, angina pectoris. And this is related to the distribution of the nerve supply of the heart and the viscera. So the pain may be diffused throughout the chest, although, yes, it is the typical pain is retrosternal chest pain, but sometimes the pain may be diffuse. Onset, the speed of onset and any associated circumstances. The character described by adjectives, example, whether the pain is sharp, dull, burning, tingling, boring, stabbing, crushing, tugging, preferably using the patient's own description rather than offering suggestions. This means by the patient own word, how he or she described the character of pain, and not to suggest to them whether he or she have such as or that pain. Radiation, either through local extension from the site to local extension, or there may be referred pain by a sharp neuronal pathway to a distant unaffected site. For example, patient may have diaphragmatic pain at the shoulder tip via the phrenic nerve, that is the C3 and C4. Associated symptoms. For example, patient with migraine may have aura, this accompanying migraine, numbness in the leg with back pain suggesting nerve root irritation, timing, that is the duration, course, and pattern since onset, episodic or continuous. If episodic, duration and the frequency of attacks. If continuous, any changes in severity, exacerbating and relieving factors, circumstances in which pain is provoked or exacerbated, example, by eating, specific activities or postures and any avoidance measures that have been taken to prevent onset, effects of specific activities or postures, including effects of medication and alternative medical approaches. Regarding severity, as we said, it is difficult to assess as it is so subjective, sometimes helpful to compare with other common pains, example, toothache, variation by day or night, during the week or month, example, relating to menstrual cycle. History of past or previous illness should include all important medical illnesses, example, ischemic heart disease, connective tissue disorders, diabetes, tuberculosis, valvular heart diseases, renal or liver diseases, and the questions about common infectious diseases during early childhood, and etc. Past surgical history, including operations and any injuries. Beware of accepting ready-made diagnosis. When the patient gives you a ready-made diagnosis, you have to be assured that the patient really have this disease, either by asking the patient a few questions in order to clarify that he or she really and truly have this disease, or if the patient have document that he or she have this disease, or sometimes, in some cases, it may be necessary to communicate with doctors or hospitals that have treated the patient in the past in order to get the old record from the treating doctors or hospitals to confirm that the patient have this problem, because this may be related to his presenting problem. Menstrual history. In the majority of women, menstruation occurs about every 28 days. Ask at which age menstruation began, and if menstruation has ceased, ask when this occurred. The menopause usually occurs toward the end of the 5th decade. Questions about the amount of blood loss and the duration of menses. It is probably abnormal if it lasts for fewer than 2 or more than 8 days. Ask about premenstrual tension and about presence or absence of pain with periods. Ask about contraceptives, obstetric and gynecological history. Treatment history, we have medical and surgical treatment history. Here we have to take details of drugs taken, including analgesic, oral contraceptive, psychotropic drugs, and if of surgery, radiotherapy, and psychotherapy are important. Adverse drug reactions, whether the patient received a drug before and have adverse drug reaction, allergic reaction, hypersensitivity, and this is important. Knowledge of current therapy also necessary to avoid drug interaction, because if the patient taking certain medication for whatever cause, and you are going to prescribe a drug to the patient due to his or her illness, then you have to avoid interaction between these different drugs. Maybe a clue for a diagnosis of past illnesses. So patient may give you a history of drug that he or she used before, but the patient not tell you precisely what he or she had before. So by knowing this treatment, you may clarify that the patient have such a disease. Family history, patient position in the family and the ages of children, if any. Record state of health, similar condition in the family, other important illnesses, and the cause of death of immediate relatives. Family tree study for genetic factor in cases of hereditary diseases. This means that when the other member of the family have the same disease, this means that we are dealing with a familial disorder, for example, thalassaemic syndrome. Social history, the patient's physical and emotional environment, including their surroundings at home and work, and their habits and mental attitude to life and to work are essential components of the history that assessing the effect of illness on the patients and on their family. Also important to ask about the following: domestic and marital relationship, home surroundings, diet and use of alcohol and tobacco, travel abroad, because if we return back to travel abroad, for example, patient may travel to area endemic in malaria, and if he had fever consistent with this, so there is a link between traveling to this area and getting the disease. For patient consuming alcohol, there may be alcoholic liver disease, for example, and the patient may have jaundice, may have ascites, and liver cirrhosis. Chronic smoking may have impact on respiratory system, and this could be related to chronic obstructive pulmonary disease, and later on to bronchogenic carcinoma. Diet, as we said, may be related to certain diseases. For example, those who are true vegans may have vitamin B12 deficiency because this is present in animal source. Home surroundings is important. Domestic and marital relationships, again, is important to ask about in taking a family history. And social. Occupational history, is the job dusty? And if so, what tools make the dust? Are there fumes or vapors? And if so, what are the chemical substances involved? Is a hood installed over the bench, and is it connected to a suction system? Is protective clothing provided? Is a special suit and goggles required, and why? Has any similar illness affected a fellow employee? All this important because here the job may have an impact on the disease. For those, for example, when the job is dusty, this may cause chronic problem on the chest, for like what is called the pneumoconiosis, or if the patient have bronchial asthma, this may be aggravated by exposure to the dust. The same applied for fumes or vapors, and if the chemical substances involved in this fume or vapors maybe have impact as a disease, maybe on the skin, on the respiratory system, or in the other system. Whether in the environment of the patient's job, there is healthy instruction and healthy measures like using hood over the bench in order to relieve all these poisonous substances. whether the patient is protected by clothing, and whether they have special suit and goggles. If the answer is yes, why they use these suit and goggles? This means that they deal with dangerous substances. And if the other member of fellows in the same environment and with the same job have the same illness, this means that there is impact of job in the illness of the patient. Review of systems. We have the general. We have to look to the weight of the patient, sleep and energy, GIT, abdomen and pelvis. Upper GIT, we have to ask about the pain, appetite, vomiting, flatulence, water brush, heartburn, dysphagia, and other symptoms. Lower GIT, we have to ask about whether there's diarrhea, constipation, pain, liver and gallbladder, jaundice, pain. Genital system, there's impotence, sexually transmitted disease, problems of infertility. Cardiovascular system, we have to ask about dyspnea, pain or tightness, palpitation, cough, edema, and other symptoms. More detail about the cardiorespiratory symptoms, the chest pain, exertional dyspnea, that is a breathlessness, quantify, exercise tolerance, and how it has changed. Example, stairs climbed or distance walked before onset of a breathlessness. Paroxysmal nocturnal dyspnea, the patient awake from sleep for seeking for air due to shortness of breath. Orthopnea, a breathlessness on lying flat, a symptom of left ventricular failure. Quantify in terms of number of pillows the patient must sleep on to prevent dyspnea. Edema, you have to look to the ankles, edema, legs, and lower back. These occur in the dependent areas. Palpitations, awareness of heartbeats. Can they tap out the rhythm? It may have impact and change the rhythm of the heart, particularly when the palpitation occurs due to what is called ectopic beat. Cough, that's sputum. Hemoptysis, there is coughing of blood. It's particularly for patients with respiratory symptoms. And the wheeze, this is again for patients with respiratory symptoms. The blood, we have to ask about lassitude, it is weakness, tiredness, dyspnea, infections, blood loss, skin problems, diet, past history, drug history, occupational history, lymph glands enlargement. All these symptoms we are going to talk on detail about when we are going to discuss the introduction to manifestation of blood disorders. Respiratory system, as we talked earlier, to ask about the cough, sputum, breathing, wheeze, chest pain. Urinary system, system suggestive of renal failure. We have to ask about the urine, whether there is frequency, there is dysuria, there is nocturia, there is changing color of urine. Skin diseases, nervous system, there is history of stroke, epilepsy, and other common neurological symptoms like headache, dizziness, vertigo, numbness, paresthesia, weakness in the upper and lower limbs, asymmetry of the face, and the cranial nerve abnormality. Locomotor system, to ask about the joint and backache as a part of locomotor system. So this is the end of the first lecture, and the second lecture we are going to talk about physical examination.